Standard treatments for trauma like CBT, counselling, other talk therapies, reframing, that sort of stuff, they don't work. They don't have lasting results because all you're doing is working on a surface level. So let's find out more. For those who already know me, welcome back. Nice to see you again. And for those who haven't met me before, my name is Lindsay and I am a chronic pain and trauma coach. So I specialise in helping people with chronic pain conditions, chronic health conditions and trauma to recover because they're very much interconnected usually. So I work with the whole breadth of them using all sorts of different modalities to help people get back into their lives. So today we're talking about treatments for trauma and why the standard ones that are usually offered just aren't effective, they don't work. So if you think about trauma, it's very much a memory, a thing, an event, an energy that it's got stuck. It's not been processed. You've had this event that's been hugely upsetting, very powerful, and your whole body and your mind has gone into overwhelm. And then for whatever reason, it's not been allowed to process, to complete that kind of the normal fight or flight response, whereas normally you go up into the stress response and you come back down again. When you've experienced trauma, you just stay up here. You never actually come back down properly. You just kind of keep going round and round and round in a loop. So standard treatments like CBT and talk therapies, they try and deal with trauma through talking about it, reframing it, desensitizing yourself to it, to whatever's happened. But the trouble with that is two things. One, you're rehearsing it. You're going over and over and over again the same thing. So you're retelling that story over and over again, and that's just practice. And when you practice something, you get better at it. So that means you're getting better at thinking about it. You're getting better at having those feelings. It's counterproductive. And we all know what happens when you retell a story. It's like telling the fish story, isn't that caught a fish this big, and then next time it's that big, and the next time it's that big. The more you tell the story, the more you rehearse it, the more exaggerated it becomes. So that is really counterproductive when what you're wanting to do is to reduce your reaction to it, not increase your reaction to it. So it can be re-traumatizing. The other reason why it doesn't work is because you're working very much on a conscious level. So you're looking at dealing with it through logic and through your conscious mind, and trauma isn't logical. It's fundamentally not. Anyone who's experienced it will know it's not logical. And so therefore it's just like trying to get rid of a weed by pulling the leaves off. And you keep pulling them off, but actually it's still going to keep growing. It's just going to keep coming back. And that's what happens. You might find some relief for some short periods of time, but actually it just keeps popping up again and again and again and again. So by dealing with it with CBT and stuff like that, you're just dealing with the surface. It's like putting a plaster on it, and you never actually get into the issue. You never get into the root cause. So what that means is that you're constantly having to manage it, to manage the thoughts, to manage the behaviours, to manage the symptoms that are being caused by this memory, by this trauma. And that's exhausting because you're constantly having to keep an eye on everything, keep tabs on everything, check everything. You become hypervigilant, and you're kind of having to put that lid back on the box constantly because it's trying to push its way back out again. And that isn't dealing with it, that is managing it, but you're never actually getting rid of it that way, are you? You're never actually processing it. So what is more effective is to deal with it on a subconscious level, on an unconscious level, on a somatic level, from your nervous system. So getting your brain involved, getting your body involved, getting the whole system involved on dealing with this trauma, this memory, this whole energy that is trapped within you. And by doing that, you can allow it to start moving, you can allow it to start shifting, and then it can be processed, and this whole cycle can stop, because then you can move on. That memory doesn't have to be traumatic anymore, and it can be done so quickly. This is what I find so frustrating, is that I hear people who've been going to therapy for 5, 10, 15, 20 years, and they still feel the same. They still have the same issues. So that's surely telling you something. That's telling you that it's not working. Whereas actually you can deal with stuff so quickly and so effectively these days by using the right processes, by using the blast technique that I use, by using inner child work, by using parts work, by using all these different somatic works. These all allow that deep connection with the root, because what we're doing then is we're getting the root of the weed out. We're digging it up and we're chucking it away, and it can never ever come back. And that is how powerful it is, because you get into the cause of it. You're not just sticking a plaster on it. Plasters don't work for trauma. They really don't. And you might get some short-term relief, you know. So if you're offered CBT, if you're offered counselling, and that's all that's on offer, take it, because you know it will help in the short term. What it won't do is create that lasting change. So by doing the deeper work, by getting to the root cause of the situation and releasing that and moving that, that's when you find the freedom. That's when you can release that trauma, release that energy, and move on. If you find this video helpful, if you think it would be helpful to somebody else, do like it, do share, do put comments. If you've got any questions, you know, fire away, and I'll see you next time.